Good evening, Los Angeles. I just came from our newest vaccination site here in the city of Los Angeles on the campus of USC, a parking structure, catty corner from the main campus, where I saw Angelenos come in and walk, drive, and receive their vaccines. It was an amazing scene. And of course, the firefighters, the clinicians, the core workers, and everybody who's worked hard to make this happen, to serve South Los Angeles and to serve our entire city, are evidence to me of better days that are already starting to bloom. I want to begin by making that clear. Things are beginning to change for the better. Our progress is happening. Sometimes it feels too slow. Sometimes it feels like it's just gradual, and we know that it's fragile. It can be undone. But more and more, our battle against COVID-19 seems headed in the right direction, and I certainly am filled with a lot of hope in our city. I hope you are as well. We see the evidence across the board. We see it in LA's vaccination effort. As of yesterday, the city of Los Angeles has administered more than 500,000 doses, 545,415 to be exact, of life-saving COVID vaccine. We see it how rapidly we've deployed the remarkable Johnson & Johnson vaccine, getting together with our previous Pfizer and Moderna vaccines, more than 2,000 doses of Johnson & Johnson in people's arms already. And this shot is gold. One dose and you're done. We see it at our mobile outreach for vaccine equity clinics, something that nobody less than Dr. Fauci praised this week in a radio interview here in Los Angeles as an example for the country, where we're going into our hardest hit areas, not waiting for people to come to us, but going to those neighborhoods and partnering with trusted community organizations to administer almost 20,000 shots directly to Angelenos, at least 94% of them which have gone to people of color. And as I mentioned at the newest vaccine site today, the appointments in our USC site after just 2 days have primarily come from the top 5 targeted zip codes in South LA, indicating that this site is doing exactly what we hoped: bring greater equity and access to all Angelenos to make sure we can put COVID in the rearview mirror and save more lives. Today, the County Department of Public Health opened up vaccinations to janitorial and custodial workers. And as I've said from this podium so often, thank you to everybody who works as a custodian, as a janitor, who has gone to work even in some of the most dangerous days. As essential workers, we see you, and the county is finally also recognizing that we must prioritize your protection. Public transit workers, too, we see you. As chair of Metro, I know what that loss has been for our operators and engineers, for folks who are our supervisors. Too many lives lost as you have been there for us to get to work, to get to the market, to get to the doctor. And we will update our appointment system over the next 24 hours in the city to be able to open those spaces for these new folks who are able to come to our vaccination centers. And next Monday, March 15th, people with severe underlying health conditions will be eligible to get their shots as well. And I want to thank so many advocates in the disability community I met with this week to ensure that we make our sites as accessible as possible, like our dedicated lane at Dodger Stadium and our in-home vaccination pilot that's bringing vaccinations to folks with severe disabilities who are not mobile at all. We've administered more than 87% of our city's vaccine supply, a sign that when vaccines do continue to ramp up here in LA, we are ready to meet the challenge. We see progress also in our COVID infection rates that I want to share with you tonight. Infections continue to drop with a current 7-day average of 1,604 daily cases. And hospitalizations, I was so happy to hear this news, are on the decline, down 37% again. Last week. The number of patients in intensive care units is at its lowest level since mid-November, for the first time, I believe, tonight under 1,000. And this statistic should also inspire us about the work of the vaccine. For the first time in the Golden State, folks over 65 are not a majority of our COVID patients in hospitals. Evidence that our vaccinations of older Californians has helped us keep them from the hospital. In simple words, the vaccines work. The data trends have real implications for our local economy, for our businesses, and for our families and communities. If this progress holds, LA County could move to a less restrictive tier in the coming week. One final note about vaccines. Self-defined men, as we know, have disproportionately been a percentage of the deaths during this COVID pandemic. In fact, statistics that we see nationally show that about 63% of deaths have been self-identified men. But when it comes to the vaccine, as of a couple weeks ago, about 58% of the vaccines were self-identified women, about 41% self-identified male. It is very important that everybody get this vaccine. We need men to step up, we need women to step up, we need non-binary folks to step up. Everybody needs to get their vaccine. And so I hope that folks will look at that and nobody will say, I don't need it, I'm tough. It is something for all of us to do to save the lives of everybody we care about. So we can't let our feet off the gas. All of this shows that our interventions are working. Wearing a mask, keeping that distance, washing our hands, making good decisions, not doing stupid things. This continues to help guide our work and listening to our public health guidance so that we can move in the right direction. Last night, some great news came forward, and families across LA and other neighboring cities got the long-awaited news that kids will soon finally be returning to LA Unified schools. And I want to thank both the school board and superintendent and our unions for coming to agreement to make sure our children are put first. This is a product of our collective resilience and effort, and I applaud our LAUSD leaders and UTLA for coming to an agreement, and SEIU, that keeps teachers and students safe, provides relief to working parents, and gets our kids back on track. There must be nothing more important to all of us. And today also brought exceptionally great news on the national level, as finally Congress in the House passed what the Senate had passed, and the American Rescue Plan is headed to the Oval Office for Joe Biden's signature. This plan is a turning point in the life of our nation. For a year, you've heard me from this podium lobby. When I'm not in front of the camera, I've organized mayors, our constituency groups, and others to say we need help for those local communities on the front lines, our public health workers, our hospital staff, our first responders, those people who have put their lives on the line and tragically too often lost them, that we needed to be able to get the resources to win the final fight and to pay for the fight that we have fronted for America. What this means is that more families and frontline workers will soon get relief checks. More resources will be dedicated to studying and stopping the changing virus. It means that our local vaccine efforts will get a boost. Small businesses and renters and landlords will get a lifeline, and our economy's engine will begin to hum again. We fought so hard, so long for this landmark legislation, which does much more than just respond to the crisis of COVID. It is also the most progressive piece of legislation, one of the boldest things we have seen in this country since the Great Depression and FDR. I want to thank President Biden and Vice President Harris, Speaker Pelosi and Leader Schumer, and our congressional delegation who never quit, as well as our state and local governments. We are set here to receive in the county $1.9 billion, in the city of Los Angeles $1.35 billion to help pay off those bills that we have. I often talk about what it was like during this time. We took all of our savings account, our reserve fund, and spent it down so that we could protect you. We took out our credit card and started buying things on credit, like PPE and other things, so that our hospital workers would be protected. Now with this money, we can put that money back into the savings account. We can pay off the credit card, and any cuts that we've made in critical services we can restore. This is great news. But it's not just direct money for the city or for the county. It's direct money for Americans, for businesses, for workers, for parents, for children. Let me share some of the things that we're going to be able to do with that. I said we would work hard and never stop working, and I know that you did the same thing. In the midst of this pandemic, you kept going to make sure this city worked. And now we can do things to pilot a basic income and see that nationally, as well as pilot that here aggressively locally. Deliver life-saving mental health services and unarmed response as we reimagine public safety. Critical housing assistance that will pay off and cancel rent for renters and help the mortgages be paid for landlords. We can buoy good-paying jobs in our travel and tourism industry, attract people to come back to Los Angeles, fund critical infrastructure projects, extend childcare benefits, and push forward in the fight against homelessness, which was also included here, something we lobbied very hard for. There's money for unemployment benefits, food security, there's money to pay our public health workforce and to stand up a health corps, money to improve our pensions, lower people's healthcare costs, support students with disabilities, and here in Los Angeles, that translates into preserving vital services, protecting jobs, and providing safe passage out of the suffering of COVID-19 for us all. It places us also on stronger financial footing to ensure equity in our vaccination efforts like those I detailed tonight, and to lift up our most vulnerable neighbors in their time of need. And for all Americans, this measure fulfills promises made but never really fully kept, goals we've been working towards for decades, an expanding commitment to the children of working families. This legislation will cut childhood poverty in half in America, a line of support for parents who have been struggling with the skyrocketing costs of childcare, funds that will go directly into households that need it most, not tax breaks for the best off, but for those who are the worst off. Steps to tackle housing and food insecurity, and the boldest effort in generations to finally break the back of childhood poverty. This is government action at its very best, as it should work, not solving every problem, but giving people too often shut out of the American dream a chance at it. All of this is really good news. So now we stand at the brink, my friends, of a new phase in this fight, a moment that's full and rich with hope, where we can see a better and a safer world just beyond. But make no mistake, March still is full of risks. As I said, this is a fragile moment still, as this virus mutates and hopefully our vaccinations keep up ahead of how this virus exploits our weaknesses, exploits our changing behavior. What we do right now still matters. How we act in this moment is still defining. We're not running full speed back to normal. That would be reckless, that would be dangerous. But instead, we're walking carefully, following the evidence, getting the shots into arms, being cautious, being strategic, to make sure all of our progress, all of our work doesn't unravel as we've seen it do before. A recent study showed that about half of all adults are anxious about re-entering normal life, including many who have been vaccinated. I think we can all relate to that in some way. This new abnormal, unfortunately, is all we have come to know. Maybe you've gotten the vaccine, but your family or significant other hasn't. Maybe you're still waiting for your shot, but your parents and friends haven't gotten theirs. All of this can be tricky to navigate. But fortunately, the CDC and the LA Department of Public Health have issued new guidelines that help vaccinated people know what they can and can't do, or should and shouldn't do, in order to keep everyone healthy. As the head of the CDC said, as more Americans are vaccinated, a growing body of evidence now tells us that there are some activities that fully vaccinated people can resume at a very low risk to themselves. Here's what those things are. Fully vaccinated people can gather indoors in private homes in small groups with other fully vaccinated people without masks or distancing. If you're fully vaccinated, you can also get together with unvaccinated people of a single household in a private home. It's recommended you still wear a mask, but make sure they're at low risk or of getting severely ill with COVID. And that means that after a year apart, that vaccinated grandparents can now visit with healthy adult children and grandchildren in a normal way. They can hug, they can share a meal, and be together at long last. I know I certainly enjoyed hugging my mother and father in this past week. It was a moment I've been waiting for a year. And all of us should know when vaccination comes, it comes with the reward of reestablishing the relationship and the life that we had before. It's also a sign of how important it is to get vaccinated as soon as you are eligible. Prepare for a moment when we get out of this first phase of not enough vaccines. It's coming, and it's coming soon. As I've predicted, I think we'll see many of these tiers quickly fall down. In other words, in coming weeks, probably no later than 2 months from now, everybody who wants a vaccine can get one. And you can book a vaccine appointment simply by going to coronavirus.lacity.org/vaxappointment. And one note on what it means to be fully vaccinated. The CDC and the County Department of Public Health tells us you're only fully vaccinated 2 weeks after your second shot of Pfizer or Moderna vaccines and 2 weeks after the one shot of a Johnson & Johnson vaccine, meaning it takes a while to get the maximum possible protection. So don't go out that next day or even that next week. Wait 2 weeks until you are fully vaccinated. So no one should be waking up the day after and running back to high-risk activities. But over time, these shots, all of them, all 3 of those that have been authorized, offer extraordinary protection with a 100% success rate of preventing serious illness and death from all 3 of the vaccines. Here's the bottom line. The transition back to normal life is going to take some time. It takes the same sort of patience you've shown all year long, but it is worth it. And that world that we miss, it's coming. The ice of this pandemic is starting to thaw. There are signs all around us. Just look up to Alaska, which today became the first state in the union to knock down the tier system altogether and to make vaccines eligible to anyone over 16. That's our goal, and it's coming soon. That's where we're headed, and it's where we'll be before too long. So here's my message, Los Angeles. Keep doing what you're doing. Keep helping those that are eligible get to vaccines. Keep saying yes when it's your turn. Keep distancing and wearing your mask and washing your hands and doing the smart things that will protect us while we get those numbers up. It's estimated that 40 to 45% of our county has contracted COVID and so has some antibody protection. Another 10% are fully vaccinated, another 5, 6, 7% have their first shot. That means we're past halfway where people have some protection in this county. But we can't rest until we're way past the halfway point with vaccinations, because that's the ultimate protection to make sure we can restore our city's economy, restore our way of living here, and restore the lives that we miss. So keep wearing that mask and social distancing. Keep following public health guidance. And most important, allow yourself to feel hope. I know you haven't felt it in a long, long time, but I'm telling you, it's there, just waiting for you to feel it, waiting for you to act on it. And Los Angeles, we're going to come back. We're going to come back stronger. We're going to come back smarter. We're going to come back more equal. And we're going to come back with the ambition that this town, we're going to make it worthy of its name. A city of angels ready to do anything and attack any challenge that people put in front of us. That is the destiny of our city, and one that hangs right there on the horizon waiting for us. So stay safe and stay healthy, and sending you strength and love, as always. Thank you. With that, I'm happy to answer questions. First question, please.
Our first question comes from Dakota Smith with LA Times.
Hey, Dakota.
Good evening, Mayor. I have a question just about these various vaccination sites are opening up across the country.
Yeah.
And it almost feels like, just by the headlines, a bit of a competition. You know, Yankee Stadium will say we're 24 hours. Mm-hmm. Another site in Texas will say we're the largest, drive-through in the country. And I've heard you say a couple times that you think that Dodger Stadium is the largest vaccination site in the world. Why is it important to you to say that, to point out that LA may have the largest site in the world, and does it feel like to you sort of a competition?
No, I mean, it's a competition in a good sense. And, to see our peers, I hope that people pass us and that we aspire to keep passing them and that we all try to build more and more capacity. It's not just about who has the biggest. Dodger Stadium was the biggest. I think this past weekend, Javits Center did 13,000. We've got the capacity to easily do 15 or 20 at Dodger Stadium if we get the supply. I don't care about winning that race. What I do care about is sharing with my constituents what they can be proud of. Firefighters, core workers, clinicians, who, once we get the instructions, once we get vaccine, we make it frictionless. We step up to the challenge. We put together some of the biggest efforts. And I'm very proud, for instance, on testing, not because it's a contest or something to, thump my chest about, but we have provided more tests than any government entity directly in America. The city of Los Angeles, 4 million and counting. We don't have a public health department. We didn't start doing medical stuff, but it shows what leadership is about, collective, not mine, our collective leadership when we step up. And I want people to feel good about Los Angeles. If we can do that, we can certainly stand up an economy. If we can do that, we can accomplish and push forward with racial justice. If we can do that, we can certainly get businesses that are shut down back on their feet. If we can do that, we can reimagine how we can help build on the things we learned, from outdoor dining to the way that we can make this a more business-friendly city. If we can do that, we can house more homeless. That's why these things are important to me. And I'm very proud of what we've done, not just at Dodger Stadium, but together with our county partners. And that the city of Los Angeles is kind of the little engine that could. We're not as big as other entities, but we're the single biggest provider of vaccinations in LA County with the fewest number of sites, and something that shows people get the bang for their buck. They can count on us, they can depend on us, and we'll never stop working for them. Any follow-on?
Well, sure. I will ask follow-up on that then. I mean, I do think that we've seen city leaders and state leaders, obviously, take a beating and get a lot of negative attention. I think there's been a couple of stories written about this where people are just angry and fed up and stuck at home, and so they're taking out their anger on their political leaders. And so I would think that, running a big vaccination site and doing it well, or just doing it in a way that is fair to everyone, would be important to politicians to, basically, I don't know, try to reclaim some of maybe the lack of popularity that they might have had during the pandemic, if that makes sense. I mean, do you see LA in that light in any way?
I got to say, Dakota, I don't spend my day thinking much about that. Obviously, I know that this job comes with responsibility of praise and criticism. I try to take the work really seriously, and I try not to take myself too seriously. That's the balance in the midst of a crisis. People need me to act. They don't need to judge whether they like or dislike me. I'm here to deliver what they deserve and to save lives, full stop. I'll let others that are the observers or folks that write about this make their own commentaries, but that's not something that consumes my day. I've got too few hours to save too many lives, and that's what my focus is. Thank you. Next question, please.
Our next question comes to the line of Isai Rocha with LA Weekly. Please go ahead.
Isai, how you doing?
Hey, how's it going? Thank you, Mr. Mayor.
You bet.
Stadiums and parks were considered highest risk throughout the pandemic. From what you've been told, what changed in the science and data that allowed it to jump higher in reopening priority?
Sorry, you said stadiums and parks? Was that the thing you said?
Oh, sorry. Stadiums and theme parks were considered the
stadiums
highest
and
risk
theme parks.
throughout the
Got you.
pandemic.
So that's from the state. Got you. So I don't know exactly the data. The state has made that determination, but certainly stadiums and outdoor activities at limited capacity, we've seen generally are not the super spreaders. Packed stadium is a different thing. A theme park probably operating at 100% is a different thing. But also what we learned, I think, over the past year were two things. Controlled environments are usually less threatening than the uncontrolled environments. In other words, where you can take people's temperatures, where you can see in the future if people have been vaccinated, things like that, or where you can limit the capacity because you can control who comes in, that when you're at 10, 15, 20%, just as we've seen with outdoor dining, that isn't a super spreader area and not a great risk. Only at the worst moments may you want to close those places down. So I think with both theme parks and just normal parks, hiking, remember at the beginning, we didn't know how this thing spread. We stopped hiking. Luckily, after about a month, we reopened that up, and we realized that the evidence was showing there wasn't spread happening there. You need to be careful when you pass people on a trail, wear masks, et cetera, but that was absolutely okay. Same thing with the beaches, remember? So I think over time, outdoor activities, we've realized, with enough spacing, are not high risk, and if the numbers are low enough, those are things with some confidence you can move forward. A lot of jobs there. Obviously, I would hope that the state and the county in turn would authorize those as they have at reduced levels or greatly reduced levels initially, but that'll help those places get back to a place that when we have the herd immunity that we need and the vaccination rate that we need, that they don't stop from 0 and go to 100, but gradually ramp up. Any follow-on? No?
No follow-up. Thank you, Mr. Mayor.
You bet. Thank you. Next question, please.
Our next question comes from David Basir with Los Angeles Times.
Hey, Dave.
Hello. So So I was wondering, vis-a-vis the federal relief today, over the past several months, you've asked the city's various employee unions, police officers, firefighters, civilians, delay their scheduled raises and help the city get through its financial crisis. Well, kind of in a weird quirk of timing, it looks to me like the extension of the employment contract with the Police Protective League is going to the City Council later this month for a final vote. You now have this relief money. Is that contract extension still needed? Is the delay of raises still needed? And kind of more generally, all these, unions have like the civilian unions, for example, have already given up a raise. Should they get those raises now that you have this federal money?
So I want to be really clear, absolutely. And I want to thank our unions because it's been a critical part of balancing our budget. I think a lot of people saw the number that's coming in and figure that this is excess. If you look at what the CAO calculated, the $700 million or so from this year, look at that, and people think that that doesn't carry into the next year, but we do expect, and we're seeing still receipts way down and other needs. That's why I use the metaphor. We emptied the bank account, the savings account, something we built up over 8 years, our reserve funds. We need to replenish that. You cannot function as a city without a reserve fund, whether it's your bond ratings or whether the next emergency comes around. We are at a dangerous place. Second, where we use the credit card to be able to finance things out into future years. We always knew that debt would come back. I don't want to saddle my successor or the people of Los Angeles with a ton of debt, and that money will help us pay that debt off. So all the things we have done, this is about filling these two holes. I think probably in the last day or two, I've received more than $1.5 billion of proposals from different groups and other folks saying, spend it here. That money has to go first and foremost to stabilizing our finances, replenishing our reserve fund, paying off the credit card that we have before we see that there's any excess. And it doesn't look like there is a ton of excess in there. So it's been absolutely critical to have that partnership with our unions. We intend to continue to move forward with that. But we also promised them that we would sit down with them if it is above and beyond. It was what you do in good faith. We said, thank you for stepping up with your leadership. If things turn and suddenly there is this a larger excess of things, we'll sit down and talk to you. And if there is that, we will, but we also need to balance that with those existing priorities of the services that we had to cut, of programs that people are depending on, of capital projects that had to be slowed down. To me, our first obligation collectively has always been about that, and those raises will come. It was a matter of just, like we saw with many workers, delaying those, the reasonable thing to do, and still, even with this exceptionally good news, it's not exceptionally good news in the sense that there's a whole bunch of money that isn't spoken for that we can do anything with. That has to go pay off the bills, like any responsible household, first and foremost. Anything else?
Just so I'm clear, so you're saying at this point it is not in any way a guarantee that those unions would see their raises on their regular schedule. Am I hearing right?
You are hearing me right. But we'll do that transparently and openly. That's our promise to them, promise to the people of LA, and how we spend that money. I think the people of LA will be not only quite satisfied with, they will see that it stabilizes the city for the next emergency. It makes sure that we don't saddle them with future debt, and that we will make sure that services that were cut can be restored. Thanks, Dave. Okay, I think that was the last question for today. So I will switch to Spanish. Thank you, everybody who tuned in English. Again, be safe, and we'll see you soon. Muy buenas tardes, Los Ángeles. Esta tarde quiero clarificar algo. Nuestra situación se está mejorando. El progreso es lento y frágil, sin embargo, seguimos avanzando en la dirección correcta. Por ejemplo, nuestro programa para vacunar angelinos ha administrado 545.415 dosis de vacunas contra el COVID. Además, nuestro programa del alcance móvil para la equidad en vacunación, o MOVE, ha administrado más de 18.276 dosis en comunidades mayormente impactadas por la pandemia, las cuales fueron distribuidas por lo menos en un 94% a personas de color. Y hemos administrado más de 2.000 dosis de Johnson & Johnson, la nueva vacuna de dosis única. El condado ha abierto las vacunas a los trabajadores de limpieza y custodia. Y gracias a estos trabajadores, su trabajo durante esta pandemia ha sido crítico. Y el próximo lunes, el 15 de marzo, trabajadores de transporte público también, el condado ha abierto las vacunas a ustedes. Y el próximo lunes, el 15 de marzo, las personas con ciertas discapacidades y condiciones subyacentes serán elegibles para obtener sus vacunas también. Y hemos administrado más del 800% de la provisión de la ciudad, indicando que cuando recibimos las vacunas, sabemos exactamente cómo usarlas para salvar vidas. Las infecciones en el condado de Los Ángeles siguen bajando, con un promedio de 1,604 casos diarios. Las hospitalizaciones siguen bajando. El número de pacientes en las unidades de cuidado intensivo es lo más bajo desde noviembre, menos de 1,000. Y si el progreso se mantiene, el condado de Los Ángeles puede avanzar a un nivel menos restrictivo el próximo miércoles o este fin de semana. Tenemos que seguir prestando atención a las recomendaciones de los expertos de salud pública para poder seguir avanzando. Ayer, las familias de Los Ángeles recibieron la tan esperada noticia de que los niños finalmente van a poder volver a la escuela pronto. Felicito a los líderes de LAUSD y UTLA y SEIU, los sindicatos de nuestras escuelas, por llegar a un acuerdo que mantiene a los maestros y estudiantes seguros, brinde alivio a los padres que trabajan y hace que nuestros niños vuelvan a la escuela. Continuaré haciendo todo lo posible para apoyar este esfuerzo y lograr que nuestros estudiantes regresen a las aulas lo antes posible. Hoy también supimos que los demócratas en el Congreso aprobaron el plan de rescate estadounidense, enviando esta legislación al presidente Biden para que lo firme. Esta ley pronto enviará ayuda económica a familias y dedicará más recursos para estudiar y frenar este virus. Además, nos va a permitir ampliar nuestros esfuerzos de vacunación en la ciudad. Las pequeñas empresas y los inquilinos tendrán más ayuda y va a empezar nuestra recuperación económica. Estoy agradecido al presidente Biden, la presidenta de la Cámara de Representantes Pelosi, el senador Schumer y la delegación del Congreso. Estamos listos para recibir esta ayuda en los meses que vienen. 1.9 mil millones de dólares para el condado de Los Ángeles y 1.35 mil millones de dólares para la ciudad de Los Ángeles. Este no es en un momento, este dinero vendrá en 2 años. Por eso continuará a proteger los servicios críticos y a pagar nuestros reservos y otras partes de la estabilidad financiera de Los Ángeles. En Los Ángeles vamos a poder mantener servicios muy importantes, proteger empleos y salir de la crisis económica causada por la COVID-19. Nos permite garantizar el acceso a las vacunas para todos y ayudar a nuestros vecinos más vulnerables. Esta noticia nos trae mucha esperanza por un mundo mejor, pero tenemos que seguir adelante de manera cuidadosa. Un estudio reciente mostró que aproximadamente la mitad de todos los adultos están ansiosos por volver a la normalidad, incluyendo muchos que ya han recibido la vacuna. Mientras algunas tienen la vacuna, mientras otros en el mismo hogar quizás no le han recibido todavía. Puede ser difícil entender qué es seguro. La CDC y el Departamento de Salud Pública del Condado de Los Ángeles han emitido guías nuevas indicando qué puede hacer la gente vacunada para proteger a todos. Mientras más gente recibe la vacuna, más han aprendido sobre actividades seguras. La gente que está completamente vacunada puede reunirse adentro en casas privadas, en grupos pequeños, con otras personas que están completamente vacunadas, sin mascarillas y sin practicar la sana distancia. Si usted está completamente vacunada, también puede reunirse con la gente que no está vacunada del mismo hogar en una casa privada sin mascarillas y sin practicar la sana distancia, mientras que tengan un bajo riesgo de enfermedad grave del COVID. Por ejemplo, ahora los abuelos vacunados pueden reunirse con sus hijos y nietos que están en buena salud como antes. Pueden abrazarse y finalmente cenar juntos. Y por eso es tan importante vacunarse tan pronto como usted es elegible. Y todavía hay citas disponibles a los sitios de la ciudad. Puede reservar una a coronavirus.lacity.org/vax-appointment. La CDC y el Departamento de Salud Pública del Condado nos dicen que usted está completamente vacunada 2 semanas después de su segunda dosis de las vacunas de Pfizer y Moderna y 2 semanas después de la única dosis de Johnson & Johnson. Entonces, nadie debe de regresar a las actividades con alto riesgo el día después de su primera dosis. Pero con el tiempo, la vacuna ofrece una protección extraordinaria. Evite la enfermedad grave y la muerte el 100% del tiempo. El regreso a la vida normal va a tomar tiempo, pero esa realidad se acerca. Entonces, por favor, Los Ángeles, mantenga esta meta en mente. Use mascarilla, practique la sana distancia, siga las recomendaciones de salud pública y mantenga la esperanza. Entonces, quédense seguros y sanos. Fuerza y amor, Los Ángeles. Good night.